I want to talk about two important areas. The first is flattening the curve, and the second is treating the curve. First of all, with respect to flattening the curve, it's very important that we all follow the rules of social distancing and social isolation. What this does is lower the peak incidence of the emergence of the coronavirus. Now, the interesting thing about this is that we're lowering or flattening the peak and we're widening the curve. Now, in some instances, the actual total number of people who get infected might be similar. So we're not reducing the infections. What we're doing is lowering the occurrence of the virus so that our medical communities have the capacity to treat patients. So that's a very, very important distinction. We now have to practice social isolation so that we can help the hospitals and medical systems accommodate those people who are infected. The second, and just as important, is the idea of not only flattening the curve, but treating the curve. We have many interesting opportunities to manage the disease therapeutically. While vaccines are a little bit far off, we have some compounds, such as hydroxychloroquine and azithromycin, that is beginning to show some promise in early clinical tests. It's important to recognize that this is very early and the number of patients in these studies are very small. So we really have to avoid being overly optimistic, but there still is promise. Other therapies, such as immunotherapies that use aspects of our natural immune system, such as natural killer cells, as well as other antivirals, show a tremendous promise.